Next slide. Hepatitis B virus is bloodborne and spread through blood exposures most commonly, and with the majority of the disease caused by chronic infection leading to progressive liver fibrosis, cirrhosis, and the onset of liver cancer. About 257 million people are living with chronic hepatitis B infection around the world, with the highest prevalences in the WHO regions of the Western Pacific and in Africa, with prevalences exceeding 6%. Over 550,000 HBV-related deaths occur annually, most recently, as estimated for 2019. Hepatitis B is the leading cause of hepatitis-related disease, the leading cause of liver cancer, and over half of liver cancers in Africa are caused by hepatitis B viral infection. Next slide, please. An important element of the natural history of hepatitis B infection is that the risk of chronic infection varies inversely with the age at infection, with children infected at the time of birth being at highest risk of remaining chronically infected. Infants infected through horizontal transmission also remain at substantial risk of transmission, although lower than the risk at the time of birth, with the risk of falling for older children, adolescents, and adults. Next slide. Perinatal hepatitis B transmission is growing as a proportion of all new cases of chronic hepatitis B infection, in part because of the relative greater success of immunizing infants and interrupting horizontal transmission among infants and young children. And it's estimated that 50% of all new chronic infections will be related to perinatal hepatitis B transmission by 2030. So the prevention of perinatal transmission is increasingly important. Transmission occurs almost always at the time of birth through infants' exposures to the mother's blood. Transmission risk is highest for pregnant women with high viral loads, indicated by hepatitis B E antigen positivity, with transmission risk estimated at 70 to 90%, in contrast to a lower risk of transmission for pregnant women with lower viral loads and hepatitis B E antigen negative status. As I've mentioned, newborns are at high risk of becoming chronically infected. Data from multiple studies have shown that children infected at birth have a higher risk of having active hepatitis B infection in later life and an increased risk of the development of liver cancer. About 25% of children infected with hepatitis B will die prematurely of hepatitis B related disease in later life. Next slide, please. Now, the role of hepatitis B vaccine is key in interrupting perinatal transmission. It's recommended that hepatitis B birth dose be given to infants as soon as possible after birth, preferably within 24 hours, as a start of the completion of a 3 or 4 dose hepatitis B vaccine series, as it's integrated into the infant immunization schedule. Meta-analysis have shown that a dose of hepatitis B vaccine at birth is about 72% effective in interrupting hepatitis B transmission and the development of chronic hepatitis B among exposed infants, with a greater level of protection if the mother is hepatitis B E antigen negative. Now, with hepatitis B birth dose as a foundation of prevention, additional strategies can be added to increase that prevention effectiveness through the screening of the mother for hepatitis B surface antigen, and if possible, a positive, the infant given hepatitis B immunoglobulin, if available. Um, uh, in addition, as was recommended by WHO in July of 2020, hepatitis B surface antigen mothers can also be tested to see if they have very high viral loads, and those mothers be given antiviral prophylaxis to lower that viral load. And so the prevention is even more effective as vaccine failures are prevented with the decreases in viral load. This does require additional testing to identify those pregnant women. And the direction is now turning toward integrating hepatitis B into so-called triple elimination efforts of eliminating HIV, hepatitis B, and syphilis at the time of birth to protect infants from all of these infections. Next slide. So I think it's very useful to think of hepatitis B prevention among children, as a constellation of strategies with infant immunization through the EPI integrated vaccine delivery systems as the foundation of hepatitis B prevention, within the addition of hepatitis B birth dose, which is what we're going to be focusing on today and for this series of webinars. And then to see how you can add on maternal testing to deliver additional interventions to really bring all of that together to achieve the full benefit of all of these prevention strategies in protecting infants from this chronic life-threatening infection. Next slide, please. Recognizing the benefits of all of these and power of all of these interventions really was part of the reasons the World Health Organizations, as well as the United Nations through their Sustainable Development Goals, set goals for hepatitis elimination as public health threats, defined as a 90% reduction in new infections and a 65% reduction in mortality by 2030. Now, recognizing the young children as the most vulnerable to developing chronic infection, within those larger global goals, there are specific targets for reducing the prevalence of hepatitis B surface antigen to less than 1% by 2020 and 0.1% by 2030 among children less than 5 years of age. Next slide, please. In July of 2020, WHO announced that globally, that 2020 target had been achieved, with hepatitis B surface antigen prevalence dropping to below 1% for children less than 5 years of age globally, and for almost all regions of the world. Unfortunately, and I think that goal has not been achieved for the African region, with the prevalence remaining an estimated 2.5% among children less than 5 years of age, and the African region having the smallest proportion of countries having successfully reached this goal. So I see this as really the charge in front of us. Next slide, please. How can we work together and bring all the partners to the table to begin to better understand what resources we have available and what are the challenges in front of us, and bring those resources together to meet those challenges and improve hepatitis B birth dose implementation and the scale up of coverage, so that we better protect infants from this life-threatening chronic infection and achieve these goals for hepatitis B elimination that will assure that all children in a country, in a region, and around the world are receiving these benefits of these highly effective prevention strategies. Thank you. Help us understand where we are as far as the implementation of hepatitis B vaccination